It's the last in the life of this administration, last meeting of the Children, Adults, Health and Wellbeing Policy Development Scrutiny Panel. You walked in with a crescendo of music, so it's very fitting and apt on the last one. I was going to arrange a flight past by the Red Arrows, but that didn't materialise. So anyway, welcome to you all. And first off, can I have the emergency evacuation procedure read, please?
Yes, certainly, Chair. Thank you very much. If the continuous alarm does sound, you must evacuate the building and proceed to the assembly point. From this room, you follow the green running person signs to the exit, using either the marble staircase or the main staircase. Please do not use the lifts. The assembly point for this building is the Orange Grove grassed area just outside Brian's Restaurant. And there is an evacuation chair for use by disabled people who so wish in the corridor outside the Council Chamber Public Gallery. Alternatively, the area at the top of the marble staircase has been designated a safe refuge where persons needing assistance should assemble. Thank you, Chair.
Thank you. Item 3, apologies for absence and substitutions.
Just a couple that I'm aware of, so apologies from panel member Councillor Paul May, and also Cabinet member Councillor Dina Romero is unable to attend today.
Right, nothing further. Right, thank you. Item 4, declarations of interest. Are there any declarations of interest?
Sorry, Mr. Chair, I'm still employed by HCRG, and also I might have to mention BAP Area Play Project today, which my partner works for. Thank you.
Right, thank you. No one further? No, right. Item 5, urgent business agreed by the Chair. There is none. Item 6, public councillor statements and questions. There are none. And so we move on to item 7, the minutes of the 17th of January 2023. These are certainly the longest set of minutes we've received for some time, with very little matters arising, so it's in conflict with tradition there. So if we just go through page by page, and if there are anything that anybody wishes to identify, please notify. So it's page 6. 7, 8 and 9, 10 and 11, and 12, 13. On the 13, Adult Social Care 6-month update. The Director of Adult Social Care, she began by explaining some of the recent funding decisions that have been announced. She said that in December, 50 million had been allocated nationally to allow for the international recruitment to take place, and that Baines is still awaiting its precise allocation. We don't know what we were allocated, do we? No? Still pending that one then.
Do you want me to find out and we can send a written response?
That would be useful, certainly.
Okay,
Thank you, Alison.
Yeah.
Thank you. So we're page 16, 17, 18 and 19, 20, and finally page 21. And I'd just like to say on page 21 that our application for a further £5,000 for SACRA, I understand, has been successful. So our request has been fulfilled to as we requested. So an excellent outcome there. And so the minutes are without events then. So thank you all very much. Very unusual that, but there. So we move on now to item 8 in the Cabinet member update. And if I can invite Councillor Alison Bourne to address the panel, please. Alison.
Okay, thank you. Yes, this is my last update in this role, in this administration. And I just wanted to bring you up to speed on a couple of issues, really, that have been I think they've led to some concern and some speculation, so it seemed quite important to try to just bring you up to date with where we are with them. The first one relates to the death rate in local care homes. So you've had this paper, and I assume you've all read it, so I'm not going to go through it in detail. But I would just summarise that following the public health investigation into the figures that were reported nationally, and reported routinely on a national basis, and obviously we picked up the fact that we looked like an outlier in it. So Public Health did an investigation, and what that investigation confirmed was that the overall death rate from COVID, and this relates to the second wave of COVID, the first rate, I think the data was a lot less comprehensive because things were much more fluid and less managed at that time. So in the second wave, Baines had a higher death rate in care homes, which was what caused concern and speculation. However, the overall death rate from COVID in Bath and North East Somerset has been lower than average throughout the pandemic and including in the second wave. But what was different was that a higher proportion of the people who died from COVID at that time in Bath and North East Somerset died in care homes rather than hospital. So a lower proportion of the total deaths were in hospital. And what the investigation has shown is that there are a couple of factors that feed into that. One is that actually Baines has a higher proportion of nursing homes compared with residential. So more of the people in our care homes are physically frail. And it was the physically frail who were most likely to be badly affected by COVID. So that was one factor. And the other one was that actually, if you look back at figures for some considerable time, this trend has been the same, that more people die in care homes in Bath and North East Somerset than die in hospital. That's elderly people. And the reason for that is some years ago, Baines did a lot of work to improve GP support to care homes, which improved the confidence of care homes in managing people who were nearing the end of their lives. And what that meant was that you get fewer people who end up being blue lighted into hospital, probably just before they're going to die, and who end up dying among strangers, possibly on a trolley in A&E or whatever, and instead they die in their care home where they've lived for some time and where they are looked after by people who they know well. So that's been happening for a long time, and that continued during COVID. The trend didn't change. So I think I find that very reassuring. That actually I think that reflects good practice rather than poor practice. And the rest of the country has been slowly catching up with us in relation to this behaviour. The other thing that they do in Baines is they've done a lot more work on advanced planning at an early stage, so that people in care homes are encouraged to express their wishes for what happens when they're nearing the end of their life. So it's very much informed by residents' individual wishes. Now, it doesn't mean that people never go to hospital. If they've got something that is treatable and the treatment is likely to change the impact, of course they go, but not in other circumstances. Okay, so that was the public health findings. Public Health, however, decided that really to be very thorough, they would commission some independent research from the Applied Research Collaboration, which is a completely separate organisation related to Bristol University. And they've been doing some more qualitative research, trying to understand more about what was going on in care homes in the second wave of COVID. Now, we had hoped that that research would be completed a long time ago, but it hasn't because of the difficulties with releasing care home staff to be interviewed by the researchers. So it's still in progress, and for that reason, the research report has been delayed. But it will be concluded. When it is concluded, it will be published, and it will need to come back to this group at that point for discussion and scrutiny. But that's where we are at the moment. So that's the first item. The other thing to say is that there is an interim report that's Public Health have published which explains this in more detail, and that's going to be available on the Baines Strategic Evidence-Based Document Library as of today. So if anyone wants to look at it in more detail, it'll be there. And then the second one is just an update on the care homes that are managed in Bath and North East Somerset. And if you remember, we discussed this at quite a lot of detail at the last meeting. It was in response to the very concerning CQC report about the standards of care at Charlton House. And I think we discussed that in early January. And at that point, I think the report came out in December, and we were starting the process of trying to turn. Well, we weren't starting it. We were in the process of trying to turn the service around, because actually we've been doing that for a couple of months since the CQC first visited. I mean, what this report highlights is that the difficulties that we were facing in Bath and North East Somerset and in those care homes are not unique. And I've just highlighted some statements from an independent report that we had from Care and Support South West, which was basically making the case for the fact that care services are in a very precarious position and need stabilising and investing in. But some of the issues that they identified were things like problems recruiting and retaining staff, an over-reliance on agency staff, this is across services, contracted staff having to work excessive amounts of overtime and were getting burnt out and exhausted because of that. Managers were having to cover shifts, which was meaning that they weren't able to manage, they were having to actually provide care, which compromised their ability to develop services in the ways they wanted to. Sometimes some shifts were running short-staffed, so they were less than optimal staffing levels on the shifts, which is obviously concerning. And also a number of services were reducing or closing, which obviously has a huge impact on our ability to provide health and care services. So that's the context. I just wanted to say that despite all of that, despite all the difficulties, we are actually really making considerable progress in Charlton House now. When we came in January, we had just managed to recruit a substantive manager to the post, someone with a lot of experience. We were still struggling to get permanent nursing staff, and in a nursing home, the clinical leadership is as important as the registered management. But we were extremely grateful for support from our colleagues in the RUH, who have seconded a very senior and experienced nurse across to us. And she and the new registered manager, are really making a big impact on the service. We've now reduced our agency use by 75%. We've almost completely recruited to our care staff, and we are now managing to recruit to nursing staff. And the service is visibly different. So, I mean, it's still a very challenging environment. I can't say that, we're completely out of the woods and it's all going to be plain sailing from now on, because we don't know what's going to happen. It may be that recruitment will become more difficult again. But at the moment, we're on a very positive upward trajectory. We're expecting the CQC back in very soon. Hopefully, they will confirm the progress that we believe we've made, and that we will continue to. And if you remember, we elected to close one of the floors when we had all these difficulties. We're at the moment considering reopening those, but we're only going to do that as we recruit. So once we've got our full complement of staff on the floor that's open, we will then start recruiting to the staff team for the other floor, and we will open the beds gradually as recruitment permits. So I hope that helps.
Fine, thank you. Any questions for Alison? Liz?
Thank you, Alison, and thank you for giving us some sort of positive outlook for Charlton House, that it's getting more positive, and that things are going to get better, but very slowly. Unfortunately, the overall picture you present is really very, very depressing, and you've outlined that it's not just in Baines, but it's a national situation. But the one question I think I can now ask is, our local staff turnover rates are exceeding the national average, and I just wonder, are there any particular reasons why. Are we paying them enough, for example? I mean, there are instances where, with foster carers, that Wiltshire pays foster carers more, and we've upped up what we pay our foster carers, for example. And I just wonder, is this something that, we as a council should be looking at?
Thank you. Thanks. Yeah, we have been looking at that since the staff transferred back to the council, and we realised that it was a problem. The figure I have is that all staff have received the council-approved pay rise, and care staff are now paid nearly £2 more an hour than they were at the point of transfer to the council. Also, the pay rates for our care staff in Baines are favourable compared to the rest of the sector. So, I think we are doing what we can, and it is starting to make a difference. I think, though, we are always up against it, and there are more nursing homes and care homes opening all the time, so it is a very competitive market locally. The figures in that, in the paper for the turnover rate were for the South West as a whole, they weren't for Baines. And I am trying to get the figure for Baines. I don't think it's nearly as bad. I mean, in that paper, I think almost a third of homes said they had a turnover rate of more than 51%, which is huge and is very worrying. I don't think it's anything like that, but I will get a formal response to that.
Joanna.
Hi, thank you for your update. You've given the data on care homes and the number of people dying, but we don't have any data on people actually dying at home and what that rate was and how that sat in terms of the COVID pandemic.
Right, it was low. I know it was very low. Paul is here from Public Health and can probably give you a fuller answer than I can.
Hi, I'm Paul Scott, Associate Director of Public Health here at the Council. There were very few deaths at home, so nearly all the deaths during that second wave either happened in a care home or happened in a hospital. So nearly all our deaths, and I think it was about 4% of deaths overall were in home.
So what is the percentage rate of normally of people at home dying to what happened in COVID?
So I think there are two questions there potentially. There's one question about people with COVID dying at home,
yep,
and then another more broadly. I don't know the answer, but I can find out the answer. And if it's partly around that issue of more people died than expected at home because they weren't going in for care for their heart failure or their cancer or some other cause, I think that's recognised nationally, isn't it?
I think it's a really important question at this time. And, just saying hospitals and care homes is not enough. We need some more data about the wider picture.
It's a really good question. It's a slightly broader question, so we could look at how we can make sure you have an answer it's a slightly broader context about an overall response from health services and care, but we could come back with an answer to that.
Thank you.
Kevin, please.
Thank you. Just two quick things here. You mentioned somewhere in the report that the registered manager and the clinical lead were also helping across another home as well, or making an impact elsewhere. And I just wondered that are you considering, or has it been considered, a different model, sort of like in schools or education we have the executive head teacher over at least 2 schools plus and things. Would that be any way of going forward on the clinical lead and registered manager, or is that not possible?
We do have a manager for the CRCs. So for all the CRC services, Anne-Marie Stabbert is the manager who manages those. And then above her we have a manager for the operational services. So there is some more capacity above the registered home managers. Each home has to have its own registered manager. And it's the clinical lead who is doing more in terms of working into the other homes. I think it's quite possible that we may come up with a different model for nursing input into our care homes. So we're looking at that, and obviously we will do whatever we can to get the best it may not, it may well be that there will be a slightly different model for clinical input to our care homes than there has been in the past.
Can I just ask the second thing, which was, does the ICB have any impact on the work of the care homes that Bath and North East Somerset does in any way, or if you were thinking about clinical leads and things in a different way, would they be part of that, or is it just down to you?
Well, the ICB is a bit more of it's more of a commissioning role, and it tends to commission health services, although we work in partnership on our commissioning. Or you may want to add to this. So I think the partnership with the RUH is the more important one, because obviously they employ large amounts of nurses, and it has made a huge difference having access to someone from their resource to support us, and it's been incredibly helpful.
I can add to that if helpful. I think it's right to say the ICB predominantly has been looking at a commissioning function, but obviously now it's about working in partnership and is broader. So we have been working closely with the council and with RUH, particularly with our academy and looking at workforce. So Suzanne Westhead, who you will all know, has been leading on the domiciliary workforce work stream on behalf of BSW ICB, and also on behalf of the adult directors of adult social services across the southwest. And I think that work has been absolutely fantastic. We've had the first presentation of it. What we know from that work is that there are opportunities for looking at things like rotation, upskilling, sharing resources. And as Councillor Bourne has said, we've seen that very demonstrably here in Baines, particularly with RUH and the council working closely together. So, yeah, absolutely a partnership approach and a lot of opportunity in that.
Okay. Any further questions for Alison? Yeah, Andy, please.
Yeah, just a quick one. You say, Alison, that the CQC is coming soon. I'm just intrigued to know what the process is. Do they sort of just turn up when they fancy it, or are they invited in? Can you invite them in, or how does it work?
Look, they come when they feel like it. I mean, when I worked in the NHS, you did have some planned visits, but generally, and if it was a major inspection, you knew that they were coming because you had to get lots of data together and all the rest of it. But in a situation like this, they turn up when they wish. And that's part of it, because you don't get ready, you don't put on your best clothes, and they want to see a normal day, not a special day.
Okay, Jerry.
Thank you, Chair. Alison, last time we talked about Charlton House and the numbers of residents there and how that rose sharply when we were trying to help our colleagues in health, etc. And I'd just like to ask, I know we reduced the numbers by about half, and has that sort of plateaued out, and have some of those pressures gone away, or what is is there still a bit of an issue there? Thank you.
Yes, we stopped taking discharge to assess individuals, which relieved the pressure a lot, and that enabled us to close the one ward and just focus on the longer-term permanent residents, which is what we've been doing. So obviously that has been a much more known quantity. There'd been fewer surprises, and that's enabled us to really embed the processes that we need to, and to address the staffing problems and start to rebuild our core permanent staff. So that's the basis that we will then be opening beds from. I think we learnt a lot from trying to do the discharge to assess function, and I think we will probably not repeat that at the moment. I mean, I'm not saying we never would, because obviously circumstances can change and you don't know how well equipped the staff team will be, etc., etc. But I think we certainly learnt that just doing that with normal nursing care establishment at a time when you've got real recruitment and problems was not the right thing to do. Okay.
So you've 14 beds occupied at the moment?
I think it may be 13. I think one person may have passed away.
All right, that's grim, but there. Alison, it's not part of your report, but I wondered whether you could produce an answer to my query now. And it relates to the voluntary sector. And I understand whether it's to do with your ambitions to bring adult social care in-house, but I understand that the voluntary sector now have to tender for all of their contracts, re-tender, and it amounts to about 100 contracts. Is that correct?
We are looking into that. I mean, this is part of the changes to the community health and care services. And at the time that the decision was taken, the government had suggested that there was going to be quite a different contracting framework, but in the NHS in particular. But those changes haven't been made. So at the moment, it looks like we probably will have to tender quite a lot of our community services. But we are taking further legal advice jointly with our partners in the ICB. We had a meeting with the third sector last week and explained where we were, so they are fully appraised of the situation. They know what we're doing, and we will be keeping them updated.
Fine. I did wonder whether, throwing that one on you, whether you'd be able to provide an answer, so I'm grateful for that. Thank you. Are there any more questions for Alison? No? Alison, thank you very much. Thank you. So we move on now to item 9, Bain, Swindon and Wiltshire Integrated Care Board. And if I can invite Laura Ambler. Yes. Sorry?
Dean has written a report which he sent to us.
Yes. No, Dina has apologised that she can't be present here today, but she will. She's hoping if there are any questions, officers will be able to answer them. If there are any political questions, she'll provide answers, forthcoming answers, if and when she's informed of them.
Yeah, correct me if I'm wrong though. Is it not part of item agenda 9?
It is, yes. So I'm mistaken for not actually giving you that information. This is a trouble with a pre-briefing. I don't think I've already done it, but no, you're correct. I should have informed the committee of that. So if there are any questions that, to field towards Dina now, please can you indicate, Liz?
I should have articulated this before, but we have had the information about secondary school places. And I think the majority of pupils actually did succeed in getting their first or their second places. But I always wonder what happens to those who don't actually get their places. And I think there are a number of pupils who are being placed in schools nearest them. So could we have a bit more detail on that, please?
What happens if they don't get first? Yeah.
So they're often offered their second choice place, which they have an opportunity to accept or reject. If they don't wish to take up that, they can take forward an appeal, which is the process which will start to happen throughout the remainder of this year.
Can I ask another question? I think, because I should have prepared this better, that there were a number of children, I don't think very many, but who didn't actually have a school. And could you explain what happens? Were they allocated their nearest school? Or are we talking about, historically it's always been St Mark's, I hope this is okay to mention this, where our children have been placed if they haven't succeeded in getting any of their choices. And for some of our children it is quite a distance away from their home. So I just wonder if at this moment in time we don't have enough information, maybe it could be brought to a panel in the future. When whoever's the person in charge is there, the cabinet member.
Yeah, absolutely, we can have that conversation. I don't think we haven't got any children who have not been allocated a place. Whether it's the parental preference is a different question related to your first question, but I don't believe we have any children who have not been allocated a school place.
Chris?
Have we managed to avoid the problem of parents opting for schools they can't go to, and therefore ending up in the 8 to 9% at the end because they haven't
think it's got better this year.
Has got better.
Yeah, it has, yeah. I do have some information on that, so I can circulate that, but we look at that each year and that has improved, yeah. I can provide that information to the panel.
Any further questions? Kevin, please.
It's probably one for Dina, but it was just a question about the Youth Connect service and whether she was, or the Cabinet were actively considering any other services in the Council that could be successfully following this sort of model. Because it seemed that Youth Connect, she was showing, had been very successful in attracting awards and grants and flourished, and whether that was being applied anywhere else.
Right. And Jerry?
Thank you, Chair. My question is regarding Bath Opportunity Playgroup, which is a preschool setting for disabled children presently located at Three-Way School and operated by First Steps Nursery. Staff and families have been written to recently to say that it is going to relocate at Broadland School in Keynsham, which is disappointing, I have to say. Bath Opportunity Playgroup was founded 30 years ago by Bath parents for their disabled children, and the clue is in the name, Bath Opportunity Playgroup. And I'm told that First Steps Nursery have attempted to find another location in Bath, but have spent over 12 months trying to do that and have been unsuccessful. And I was wondering, would you be able to give me any information regarding that? They have been granted the contract to provide that service for the next 4 years, plus 2, I think. And but I know that a number of staff and families are very unhappy about the relocation to Keynsham, to Broadlands. And yeah, so if I could have some information on that. Thank you, Chair.
Yeah, that's fine. So it is the Bath Opportunity Playgroup, but it serves the whole of Bath and North East Somerset, not just parents who live in Bath, but obviously we do have parents who utilise that and staff who've been used to travelling. The Commissioner of the Bath Opportunity Playgroup has been meeting with parents to talk to them about their concerns. She's been meeting with the staff to talk to them about the concerns, but also there is a new focus on the commissioning model, which is around actually how do we support mainstream schools to support more children in a mainstream nursery, so it's not just about the provision on that site. We would very much have hoped to be able to always have the site where the most parents come from, because it's less distance to journey, but there will also be parents who benefit from it being closer into Keynsham, who will be able to drive there. So that it's not ideal, but it also will suit some parents better. It does also enable us to create another 30 additional spaces at Three-Way School, which is where some of the children which move on from BOP, which is a really significant need for us in the local area. And what I would say is if there's any specific ongoing concerns about parents that have or staff that have, just to let me know directly and we can turn to you to have those discussions with those staff.
Thank you, Chair. That's good, and I have no problem whatsoever with trying to create extra spaces at Three-Ways. You know, I know it has always from day one been a constrained site, but I was cabinet member at the time. I was given a long list of 2 sites to choose from, and there we are. But, Chair, I'm a bit disappointed. I would have thought that something as important and strategic as doing this might have come to this committee at some point in the past, and I will be taking that up with Dina, and I'm not particularly happy about that. We also now know that Baines has been allocated capital funding for a new special school, and I'm told it is likely that that will be located in Keynsham, which would be great. We would then have a special school in Keynsham, Bath and Radstock, and it would seem to me if we're creating a new special school in Keynsham, there is an ideal opportunity to create a preschool setting for disabled children in the Keynsham and Chew Valley area, and it is a shame that we are going to lose the one in Bath, and then we're driving children all around the place, and we should be trying to avoid that. And also, if we lose staff as a result of this, and not all staff from Bath Opportunity Playgroup will be able to travel to Keynsham, we will lose a lot of that experience and that expertise. And, you know, we all know that preschool settings are so vital for young children, and I believe even more vital for learning disabled children and physically disabled children. And so it's not a great state of affairs, and I would rather that I'd managed to stay in Bath. And we have on our papers a report about Culverhay School, a huge site with a lot of buildings, and I know for a fact that when I was chair of governors, the bungalow where the caretaker used to live, we created a special educational needs hub in that bungalow. You know, what is that bungalow presently being used for? Could that not have perhaps been allocated to that setting? And again, Dina is very keen on Culverhay, and I will be asking her about that as well, Chair. Thank you.
You make some good points, Jerry. Thank you. Andy.
Yes, thank you, Chair. Congratulations on your successful bid for the special school that Jerry mentioned. And I'm pleased to know that it might be in Keynsham, though I don't think that's confirmed yet, is my sort of first source of question. But I'm more interested in the actual process. I mean, I don't like this bidding process, I'll be honest with you. It seems a very, I don't know, hit or miss idea. It means a lot of work for a lot of people, some of whom will be unsuccessful, so that's just sort of wasted work. So once you've gained this 120 place special school, do negotiations go on about how much money you're going to be able to draw down from central government, or is it a fixed amount of money and therefore Baines has to contribute more to get possibly what we want? I'm just intrigued about what happens next.
Yeah, so as you highlighted, it is really positive news. I just want to just quickly, if I can just flick back just to reassure my colleague that we did search high and low around Bath, and we did put effort into trying to secure a location around the Bath area, which included looking at potential options on the Culverhay site. So I do absolutely take your point on board, but just wanted to add that information there. The preschool process, the actual final process of what happens next is actually being still refined, as I understand it. It's changed from how it is being delivered. What we do know is that the opportunity to run the school will now go on the Create website, which is an organisation that supports finding a trust or a standalone academy, because it can be a standalone academy, to bid to run the new free school. And then there's another organisation called Locate, who do the work for the DFE on identifying the site. And obviously those two pieces of work, well, particularly the work around the site, will drive into how much it will cost, the eventual build, depending on land purchase and things like that. The DFE do have a formula for how much per square metre a build should take. But obviously, if there's land that needs more work on it, it will cost more. If they need to take existing buildings down, obviously that pushes the cost up. The contribution from the LA is only for any excessive costs. So if, for example, we had to build a new road which went up to the school, that would be the responsibility of the LA. But obviously we don't be having conversations with the DFE about the particular site. The bidding part of it yet hasn't been fully announced to us, so we've asked the question, who makes the final decision? So we believe it will be the DFE will make the final decision, but we would expect to be absolutely at the table to be able to input into that decision-making process. However, I think it's right that it is more of a joint process. I think there should be some input externally and not just it be a local borough decision around that. But the actual final process of that we've not had shared with us yet by the DFE. If there's any excessive land costs which weren't foreseen when the build starts, because you obviously don't always know what you don't know, some of that potentially could come to the LA depending on what that was. But we would hope that any surveying that took place on the land would reveal those before any decisions were made about final build. I don't think there is a defined pot of money for what the DFE will put in there, but obviously they'll be keen to, like we are, get value for money.
The last question, Chair, if I may. What can you estimate the sort of timescale and all that stuff will be clear? Or is that difficult? Is that impossible?
It will depend very much on the land search and the identification of the land and how complicated a land purchase will be. So if that can be done sooner rather than later, there's no reason why with an absolute fair wind you might get something in September 25. If the land search becomes more complicated, the purchase of land becomes more complicated, it could be later than that. And planning, of course, yeah.
Okay, so thanks Andy for not allowing me to skip Dina's reports. It's instigated a lot of debate, so I'm grateful for that, certainly. So we'll go back on track now and go back to item 9. This is a Bain Swindon and Wiltshire Integrated Care Board. And if I can invite Laura Ambler, the Police Director, to address the panel, please. Laura, thank you.
Thank you, Chair, and good morning, everyone. I understand that you've got the report in your pack, so I'll just give you the highlights as per usual, if that's okay with one, assuming that it's read. So the first update that I've got for you is around the BSW Integrated Care Strategy. We've touched on this before at this panel. I think, as we all know, it's an important document. It's going to set out the improvements that the integrated care system as a whole makes together across all of the partners, and how that will deliver for local people, so in particular tackling health inequalities and delivering better, more personalised services. As we know, there are a lot of existing individual strategies that already exist, so absolutely the intention is not to replace those strategies, but indeed to try and think about how we draw on elements from them and provide a summary of how they will work together. So notably in that, we have drawn on input from partners across the care system, in particular the local authority and the health and wellbeing strategy, which I know is on the agenda today. You will perhaps expect that there will be a lot of consistency in the themes that emerge from the strategies across our area. So as you would expect, tackling inequality, prevention and wellbeing, development of communities, addressing environmental issues and those wider determinants of health will all play a part. A reminder that the strategy is actually developed by the Integrated Care Partnership, so that's the true joint partnership between local authority, health and others. I think it's important to say that there's been a number of engagement sessions to socialise the content of that strategy, so they have happened across the system. But I just wanted to draw out that in January we had a particularly successful session with your voluntary community sector group, Baines 3SG, and also with the Bath Area Forum. And just to highlight, really, I think we're really fortunate that we've got a very active participative voluntary groups in this area. They're very keen to have an ongoing meaningful dialogue, and I think we really welcome that at ICB, so that's really, really helpful. The care strategy will have an implementation plan which will support it. That implementation plan, it's sometimes called the Joint Forward Plan, will be published at the end of June, together with the final draft of the strategy itself. The intention is that it will be live and we'll continue to work on it after it has been published in terms of its implementation. So I think that was everything on the strategy. I'll move now on to public engagement more widely, and I think hopefully it's well recognised that part of our core values is that we are committed to ensuring the voices and opinions of local people influence and shape services across Bath and North East Somerset and indeed Swindon and Wiltshire. We are going about this in a number of ways. We have patient and public engagement groups, and many of you will know the Local Health Watch, for example, hold us to account for how we involve local people in design and commissioning of local health services. But in Bath and North East Somerset specifically, we have a forum, Your Health, Your Voice group, that meets every 2 months. I just wanted to highlight that to this panel. I think we're looking at reviewing that group at the moment. They're a fantastic group and they have stayed the course and had an awful lot of input. But I think we all recognise that we need to think about how we might broaden and develop that group and its reach and in particular participation from those with lived experience and patient voice. In addition, across the system, we do have an Our Health, Our Future Citizens panel. Typically, that has more online activity. We work in particular with something called Jungle Green, which is a market research company, and they help us undertake a number of surveys. So there are about 1,200 panel members on that at the moment. So to highlight for this group, it would be interesting to hear your views on how we might develop both of those panels. And as I've said, we're also particularly keen to strengthen and highlight the voice of children and young people and those with lived experiences. So if I move on to the next update, this is around the Acute Hospital Alliance. So a reminder to us all again, I think we've touched on this before with this panel. There is an alliance. It's made up of the 3 hospital acute trusts in our area. They have been together formally since 2018, but more recently they've been chosen as one of 9 partnerships in England to join something called a Provider Collaborative Innovator Scheme. So being part of that first wave will help see NHS England support us and accelerate the development of our Acute Hospital Alliance and therefore the benefits for patients. So to draw your attention to some of those benefits, it has led to improved patient care, particularly adding value to things like practicalities of back office functions and scale, but critically it's encouraged closer working with clinical teams, and that has resulted in a reduced waiting time for paediatric ENT and oral surgery and a new approach to a single waiting list. So some real practical examples there of the benefits of that joint working. And there's a joint statement that the 3 respective CEOs of the hospitals have put out together, recognising that this is a significant achievement and a big step forwards in terms of their joint working together. Chair, in the report there is an update on the industrial action. I think we all know that at the time of this being written, we didn't know whether the industrial action of the junior doctor strike would take place this week. Of course, we now know that it has. Junior doctors will be taking part in industrial action from Monday through till Thursday this week. Just to reassure the panel, as you would expect, system partners continue to work together on operational oversight and sharing of intelligence. So we have both a strategic and a tactical coordination group on that, and we're working closely with your colleagues in the council. And then finally, Chair, if I may, I just wanted to finish on what I hope is some very good news for the panel. We touched on the Community Investment Fund, which we have worked together with council colleagues and also your voluntary community sector groups. We are working with Quartet, who are a community foundation, and we're working with them to administer a Catalyst Grants programme of £100,000. That grants programme is looking to provide practical help and support to our most vulnerable in our communities. So there are 5 organisations that we're working with. They are Southside Hardship Fund, Julian House, the Citizens Advice Bureau, Age UK, and the West of England Rural Network, the Baines locality part of that only. And those partner organisations, who are all part of the Wellbeing Hub, as some of you may know, will be able to identify those who need the help the most and be able to administer the grants directly to them for cost of living. So that would include things like food, clothing and the warm home grants. The intention by doing it through a programme approach is that we can retain those long-standing relationships and connections that we make. So I hope, Chair, some good news there to end the report on. And I'm happy to answer any questions that there may be.
Fine, thank you, Laura. Questions for Laura from the panel then, please. Liz.
Laura, thank you very much for your report. It's always full of meat as usual and lots of information. But one of the things that struck me was it's very good that we've got this grant and the money is going to be delegated to 5 groups. Do you have any say in how this money is spent, or do you just delegate it? And the one that catches my eye, and I'm sorry to bring this into this panel, but it's about West of England rural networks, and it's about social isolation. And we are having lots of arguments and discussions about bus services and how rural communities can be very isolated. Would there be any money for anything like this? Or, as I said, do you have any say in how the money is spent?
Yeah, so that's a good question. We do have say in how the money is spent. The programme has been designed to target individuals. So something like looking at the transport, public transport services, I don't think this grant would be applicable for those purposes. That's not to say that we don't recognise that's a significant issue. So if there were something about individual transport costs, for example, that could be something that the rural network could think to use the grant for. But notwithstanding that, obviously we recognise that's an issue. That's the sort of thing that we need to tackle through the integrated care strategy, and where we need to work with partners more widely. But yeah, the very reason that we chose such a wide range of the 5 partners for the Community Investment Fund is recognising that those inequalities play out in different ways across our different communities.
And Kevin?
Yeah, 2 things. Well, the first one is just really clarification, because I was a little confused. When you said that you were creating an integrated care strategy, and that it was taken from lots of existing strategies, possibly, but it wasn't to replace any of them. And my confusion was that if you're producing an overarching strategy, surely that has to replace in terms of what has to be done, because otherwise, I don't know, I'm just thinking of my old past headship with various strategies coming at you left, right and centre, and you're trying to sort of put them all together. But if one's overarching, wouldn't that replace or be the dominant strategy?
Yeah, it's a good question, and you're right, it is a very complex picture. And I think that's why we're trying to highlight, I'm using my language carefully, I don't think the integrated care strategy is the overarching or the more dominant strategy, and I say that respectively to all those other partners that have got their individual strategies and which are very important. The integrated care strategy is how we all come together as partners across the system. So that's why it's drawing on those different strategies. The health and wellbeing strategy, which we'll hear a bit more about in a moment, we recognise the importance of that, and that's also a statutory requirement. So I think it's something that is complementary. It's intended to draw together those different component parts that make the system as a whole across health, care and wellbeing work. So I'm using my language carefully, not to suggest that it's above or over any other strategy, but certainly it's about us working together in a more collective way.
Okay, because you can see that when you say things like strategy, people obviously are trying, when new things come in, there is bound to be an adjustment period, and then hopefully you get to a refinement period where the order makes sense, because obviously at the time when things are brought in, you have a huge many of things happening around you.
Yeah, I agree. And if we're not careful, too many strategies can actually cloud things, can't they, rather than providing clarity. So how they work together is something that will be set out in the strategy and also in the implementation plan. So that role clarity of the different organisations, what their role is in different spaces, will be absolutely crystal clear. And I think that's the important bit for us to focus on collectively next.
And one final thing was just on the comment, and I'm sure there are better people than I that know more about this than I do, but when you say about consultation and things for young people, I know that there were, certainly in this place has been mentioned things before, like the Youth Forum, Off the Record, and things that represent young people, but I'm sure you already have been told about those.
Absolutely, and I think that's why we're highlighting it. All of those existing groups, what we're trying to do is make sure that we get those voices heard in as many different spaces as possible. So it's how we broaden the reach, I think, of that participation. But thank you for highlighting those specifically. I see Mary beaming.
Any further questions for Laura? No? No. So Laura, you mentioned about your health, your voice. And the value of that, it's people assembling people with a living experience. And what you're suggesting is that perhaps that forum could grow. And you're looking for the panel to suggest how that might happen. Well, it's a big ask. I was a regular attendee of that particular meetings, but it's diary classes. I haven't attended lately, but Zoom really hasn't helped it, I don't think. It's when you meet the people in person and you get a much better understanding of their interpretation of their experiences. And it's perhaps an approach to individuals that have been through something traumatic, whether they would like to join, because then you get first-hand interpretation of what that experience entailed. And that's the only way I can think. Most people won't want to engage with something. Most people, anything traumatic like that, they rather shy away from and don't want to be included unless it's in their professional capacity. So perhaps approaching individuals after they've been through something traumatic and asking would they like to participate in that group. And again, Zoom is very distant. You don't actually get to get a relationship with a group of people in Zoom, a meeting in person. So if that could be persuaded to get those participants to go back to meeting in person, I think that would be preferable. But that's only a personal opinion on that. I wouldn't want to miss Zoom out of context because most people find it very convenient, and some have got disabilities, and it's an easier course of action to engage. So it could be an amalgam of the two.
Yeah, thank you, Chair. I think that's really helpful, looking at a blend and a hybrid of how we might approach that. Yeah, thank you.
Right. Anything further for Laura? No, thank you very much, Laura. Thank you. So we now move on to item 10, the Health and Wellbeing Strategy. And if I can invite Kerry Williams to introduce this report. Kerry.
Yeah, thank you, Chair. Just to provide a bit of context, we met on the Monday, the 27th of February, to consider the draft strategy. All members were invited to a briefing. The Health and Wellbeing Board today, this afternoon, considers the final draft strategy, and we'll be looking to agree that. Just in terms of key points, we learned that the strategy was a 7-year partnership document with the key purpose to improve residents' health and well-being and reduce inequalities, shaped around 4 priorities. The high-level comments made on the day are in paragraph 3.4, so I guess we've got the opportunity today, because Becky's kindly come along, to explore if there's been any subsequent amendments since we met for the briefing.
Right. Any questions for Kerry? Oh, Joanna, please. Thank you.
Thank you, and thank you for that briefing. I noticed that you did pick up on one of the points that I made about housing, but what I also noticed wasn't picked up is online safety, which I raised at that meeting. Okay, sorry, somebody over there making a noise. I just wonder if we need to make more of that in this document. It's very obvious that electronic accessibility to a smartphone is making or breaking relationships, and that would also know that a lot of young people, literally from the age of 6 or 7, have phones, and how they are used and where they are used, and the online safety bill and how that is taught is of a massive issue ongoing from now onwards. And there doesn't seem to be anything in there that really encapsulates that for me. So that was one of the problems that I had with that document.
Thank you for that, Councillor Wright. It's always a difficult balance between a strategy and an implementation plan, so I guess we had such valuable feedback at that meeting. Some of those points will be taken forward in an implementation plan. So we're trying to make sure that the strategy itself sits at a high level and doesn't get into too much operational detail, and the conversation now that's ongoing between the 2 lead officers, Fidelia and Nancy, who are leading this work, with partners across the system, is now to go back to those 4 priorities and the objectives that sit under it, to think, what are the actions now that we need to put in place to implement those priorities and those objectives? So that conversation about online safety, and I think another councillor had also made some valuable contributions around gardening clubs, the importance of schools in taking that broad approach to helping children and young people learn about food and how food is developed. We will pick up when we take forward our implementation plan. Is that okay? Thank you.
Okay. Anything further? No? Oh, Andy.
Right at the end of your report, you talk about public consultation. I just wondered if there was any more information about how many people were consulted and whether there were any general principles that you got from that activity would be helpful.
Yes, so there was, I can get some of the details to you afterwards, but yes, there was engagement with different parts of the community through different routes. So there was a survey, a questionnaire that was put online and was heavily promoted through organisations and through our third sector organisations. And then there was engagement through third sector groups themselves, so through 3SG, through BEMSCA and through a number of other organisations that officers went out and ran focus groups and had conversations with members of the community to get their thoughts and their views on a set of questions: what impacted on their health, what was of great concern to them, what concerned them about the health of their children, and it's from that then that's contributed to the shaping of the priorities in the strategy. I can get more information if you would like some more detail, if that'd be useful. Yeah, I'll do that. Thank you.
Fine. So it's obviously not a contentious subject, the fact that most of the panel remaining silent on this, but the four priorities are very appropriate, and when you look at the discussion points there are some quite significant points when you say our wage levels in the Bains are lower than the regional neighbours. So there's some quite shocking headlines, and but then they're complementary in the fact that we're below average on smoking levels. But then there's 1 in 2 adults are obese, and so it conflicts in different directions. So the priorities as they're being determined are extremely appropriate, but there's a lot that lies underneath that. So when it goes out into public consultation, the public will be made aware of these, I trust.
Yes, so the consultation has happened, and that has informed and led to us developing these four priorities, along with analysing and looking at our joint strategic needs assessment. And the point that you've made about the breadth of our priorities is hugely important. What we didn't want to do is focus on, for example, smoking or overweight or obesity, because that doesn't necessarily recognise the breadth of everything in people's lives that impacts on their ability to live healthy lives, which is why we've gone very broad. We've included children and young people, because it's so important that children and young people have a good, solid start in life, and we've picked up some of the data that we've identified through the strategic evidence base around mental health issues and concerns amongst children and young people, especially coming out of the pandemic and the impact that's had on them. We've got priorities in here around the local plan, so that's a much more longer term viewpoint, recognising the importance of transport, housing and the economy for our population to live and remain healthy. And then we've got a lot of work around the communities and the importance of compassionate and communities that are strong and resilient, and recognise the importance of our third sector and the importance of strong community networks. So we have gone quite broad, and Wiltshire have gone a very similar way actually in terms of recognising the importance of starting well, living well and being able to live well in our communities as well as the economy.
Yeah, we seem to have quietly gone distant of what I would call norm. You know, being that much older and things that I was brought up on. I was brought up to garden. I still garden now. So it gave the foundation for that future. And we're consistently now trying to get youngsters to engage with nature, and it's so real and reflects on their well-being right through life. So I see it as all important. So thank you very much for this document then, and we note the report. All in order with the panel? Looks to be yes. So then we move on to item 11, and we're going on to serious violence duty. And if I can invite Sally Churchyard, Sally, to introduce the report, please.
Thank you, Chair. There is a paper, but I have also produced a short PowerPoint, if that's helpful, to summarise it. So I'll do that. The paper sets the context for this, that all reported crime, and including serious violence, in Bath and North East Somerset is comparatively low. Nevertheless, we do understand that it has a disproportionate impact on those directly affected and the wider community. And so we do have a local ambition that everyone living in our community should be free of serious violence at home and more widely. Right, I wonder if this will work. Hey! So it was 2 years ago that we had a scrutiny day on the anticipated serious violence duty, which was eventually published and implemented in December 2022.
with guidance, and commenced at the end of January this year, as you'll see there. It requires those public authorities, the specified authorities, to collaborate to prevent and reduce serious violence, and also to consult with relevant authorities. So education, a key partner in this, our schools and other staff supporting education and those in colleges. Prisons and youth custody, we don't have such establishments in our area, so we're not required to directly consult with them, but there are still things we can learn with our networks with those institutions. And the duty also makes tackling serious violence an explicit priority for community safety partnerships. So what is already in place? I think when I came a couple of years ago, I did talk about the Violence Reduction Unit that we are part of. We follow a hub and spoke model with the Police and Crime Commissioner's Office, the hub at the heart of the work of 5 autonomous local authorities. So there are 5 different violence reduction units, all working in slightly different ways to meet local needs. The focus has mainly been on public space violence, or so-called street crime, arising out of that national strategy that was published in 2018. And we produce annually a strategic needs assessment and a response plan, which is monitored by a serious violence steering group. What we have in place at the moment in terms of strategy were produced in 2019. We have a strategy focusing on vulnerable teenagers in our area and 6 underpinning protocols that look at harmful sexual behaviour, radicalisation, criminal and sexual exploitation, serious violence and children who go missing. Through the Violence Reduction Unit, we have funding until the end of March 2025. And the arrangements we have sit underneath our local safeguarding arrangements. So what does the duty require? Of course, perhaps I should highlight there are only 20 police force areas in the country that have violence reduction units. The duty applies across the piece to everyone. So we all have different starting points. And a lot of what is in the duty we are already well placed to deliver because of the work of the Violence Reduction Unit. So those authorities need to produce a needs assessment, a strategic needs assessment. We have done that 3 times in this area, but we need to continue to build on that. We need to improve our information sharing and make that a richer document so we really understand what are the key needs in this area. We've got a year, just under a year, to publish a strategy to prevent and reduce serious violence. And we're asked to take a public health approach based on an understanding of what is effective in addressing serious violence. The duty requires annual review and monitoring and evaluation of the impact of whatever is put in place. And it also sets out some specific responsibilities for different partners, and I've just highlighted here that local authorities and police actually are specifically asked to support prevention and early intervention activities. But what is very welcome in the guidance is a strong push to align and improve, to build on what is already in place, not to set up new structures, not to have a new suite of meetings, but wherever possible to extend what's already in place. So just a quick word about what is a public health approach. It takes as its starting point that violence is preventable. It's not inevitable that we have to live with serious violence in our community, but that the root causes are very complex and no one sector, no one agency, no one discipline has the solution. It's only by working together that we can address things effectively. We need to work in a defined geographical area with a focus on root causes, so going right back to the beginning really of children's experience pre-birth and in their early years. And we need to find effective responses, and that may well be taking ideas from other areas, looking at published research, looking at the Youth Endowment Foundation, which is building a nice library of work that's been done to evaluate approaches in different areas, but also to build our own solutions and then to scale those up and really embed them in the way that we work with children and families. A public health approach takes a long-term view. We're talking about generation upon generation. There are no quick fixes here. And I've added some principles at the end, the so-called 5 Cs. We're working with CREST, who have been appointed by the Home Office to support local authorities, and they're really promoting this approach. The collaboration between partners, the cooperation to bring together a kind of shared drive, a shared ambition, co-production, so working particularly with those most affected, and that includes children and families, to build a counter-narrative, so really focus on what are the protective factors, what are the kinds of things that support children not to get drawn into serious violence, and to be listening to our community and understanding those concerns. The report does set out these 3 measures that have been in place for violence reduction units and continue with the serious violence duty. Homicide rates, hospital admissions and police recorded knife crime. Homicide rates in this area are thankfully very low, but any death as a result of serious violence is a tragedy for the local area. And we've had 1 in each of the last 2 years. The hospital admissions data is presently hard to get hold of, but police recorded knife crime in this area, I'm pleased to say, has reduced in the last 12 months, bucking the trend across the wider Avon and Somerset area. But we're also encouraged under the duty to develop our own ways of measuring our success. And we are interested particularly in looking at school exclusion rates, drawing as well on a piece of work that was undertaken recently looking at the experience of black people in our criminal justice system and following through on some of the recommendations there to understand our data better and to focus on the children who are most vulnerable. And then we might also want to develop measures about the wider impact of crime and the fear of crime, which is in every area always disproportionate to the actual level of reported crime. So last slide, next steps. This is a rapidly developing piece of work, and there's quite a lot happening in the next bit to get ourselves ready to meet that target of next January for having a strategy in place. Those of us involved in the violence reduction units are currently holding a series of meetings with the Police and Crime Commissioner's Office to review the model and the funding and the respective roles and responsibilities, and to be asking ourselves, is what we currently have fit for purpose going forward? Do we want to tweak it? Do we want to revisit it? What is the Police and Crime Commissioner going to hold continuing responsibility for? And that may well include supporting us around obtaining data and looking at evaluation. And what are we going to hold at our local level? And we have appointed a coordinator for our violence reduction unit. And what will her role and her responsibilities be going forward? We've got a whole series of groups where we are promoting the duty and updating people on what's happening. The Serious Violence Steering Group is next meeting towards the end of March, and that will be quite a key time to get a sense from across the partnership of what people believe we should be doing. By the end of March, we need to notify the Home Office of our preferred approach, and the guidance does highlight lots of ways we can do this. It does
give a strong steer that where there are violence reduction units in place, we should be building on those. But we do have other options. One is through community safety partnerships, through safeguarding partnerships, through the local criminal justice board, through integrated care boards, health and wellbeing boards. There are lots of mechanisms because it is such a wide-reaching agenda with that public health approach. It could fit in a number of different settings and a number of different strategies. We're going to take a paper to the executive group of our safeguarding partnership in early April to review our definition that we're using of serious violence and to have another look at the governance arrangements and see that they're still fit for purpose going forward under the duty. And I've just listed some of the ongoing work there that Sophia Mackenzie, the coordinator, and I are involved in, promoting the duty wherever we can, working with Crest Advisory, continuing the work of the Violence Reduction Unit, which, as I said, is funded until the end of March 25. And it's quite interesting to think about the extent to which the two agendas completely overlap and where there is difference and how we plan for the longer term. And we also have identified the need to really strengthen children's participation in this agenda and the wider community's agenda of participation as well. So that's just a kind of summary of what's in the report and maybe a couple of slight updates. Thank you.
Thanks, Sally. Thank you. Questions for Sally? Liz.
Hi, Sally. I've got a number of questions for you. I think, would you agree this is underpinned by the police, by the Commissioner for Police and Crimes? And it looks like we have a very large role here as Baines, but we are very much part of a partnership. I mean, I'm just throwing that in because I think maybe we need a bit more on that. But I've got a couple of questions, and it said that the introduction of a serious violence duty for local authorities, and that Baines will build on existing arrangements. And I realise I can answer this myself because it's all part of the Violence Reduction Unit, and I went to that day, and obviously it was quite comprehensive in what is being planned. So I assume that is what your current existing arrangements would be. So I think I've answered that myself. You do mention, the second question is, you do mention that we have to decide our approach. So what is our approach? So that's the question I'd like to ask. Are there different approaches, and then which one are we adopting? And lastly, you mentioned about children from Black, Asian, minority, ethnic heritages, those with special educational needs. You mentioned particular vulnerable groups. And they are areas of greater social deprivation, all being particularly affected by serious violence. Is this part of our strategy now? I think it probably is as part of the Violence Reduction Unit, but these results are quite worrying about how these groups are very much, overrepresented in their experience of violence. And I just wonder, is this part of our strategy at the moment? Are we? You talked about the youth at risk strategy. Would that be part of it, or is this something new that you're thinking about? Thanks.
Okay, thank you. Well, I'll try and do justice to those. The comment you make about the Police and Crime Commissioner, yes, he and his office lead this agenda locally. And it probably is worth acknowledging that it is only because we are part of the wider Avon and Somerset policing area that we have benefited from some additional resources and focus on this agenda. We're not deserving of it in our own right because thankfully we just don't have those levels of serious violence that prompted the national strategy a number of years ago. So we have benefited from that. But yes, that office has led the work and held the work through a strategic board. So that was your first comment. Then you asked about changes to our strategy. I mean, we need to consult, we need to see what people want.
Currently, the strategy is put together with a real focus on under 25s. That focus does remain in the guidance, but it becomes more of an all-age strategy, and that has huge implications in terms of how we focus the work and how we resource the work. The Youth at Risk strategy and its 6 protocols are quite out of date now. Things change very quickly. Our understanding of the agendas, all the things we've learned in recent years about exploitation, particularly of children, about the importance of taking a contextual approach to safeguarding and the importance of a trauma-informed approach. Those things are within the strategy, but they're not well developed, and I think we're now in a place where we understand a lot more. We have a better trained workforce in terms of those issues, and we are taking steps forward in thinking about, again, the wider evidence base, and particularly around contextual safeguarding. There is now a national toolkit which is available and which we can draw on some elements of. One of the pieces of work that the Violence Reduction Unit does is host an information sharing setting between a very wide partnership to look at individuals who are identified through police data or through any member of the partnership giving us the name and the reason for their concern. We also look at networks of children and young people, and we also look at places of concern. And we're developing a methodology based again on what's happening elsewhere, but trying to find our own best way of doing it, to provide assurance to the partnership that the information sharing is working, that where there are concerns, there are assessments and plans to address them, and where there aren't, we do a bit of multi-agency problem solving about the best way to offer services to children and families who are not currently working with us, but where we nevertheless have concerns. So I think all of those things will be much more evident in our new strategy. They'll be much higher profile. But I mentioned the meeting with the safeguarding exec, and I do need to hear a steer from them really around governance as well, and how things fit together and which parts we're going to focus on and how that fits with the wider strategies. And as I've already said, children's participation, I think, needs to become a much bigger component of what we're doing. So that was one. I wondered if I had anything else. Do you think that answered all your questions? I had to have some other notes. But
I mean, the PowerPoint presentation was very illuminating.
That did give a bit more information,
yeah, and it answered an awful lot of things I was wondering about, and your answer has been very comprehensive, so thank you for that.
Okay.
Thank you.
Joanna.
Thank you. Thank you for your presentation. I'm delighted in reading the government's strategy of this for its 2018 document, introduced by Amber Rudd. In it, she talks about teachable moments,
yes,
excluded children, and how the process of unplugged, and how we need more youth services. Now, I know in this area of Bath and North East Somerset, in the ward I represent of Lambridge, we have nothing. We have an ongoing problem locally in our area, and we've recently just contacted Youth Connect, who told us there is no budget to support you or help you with the problems that you're facing, which are by a very young group of people. But you just wonder how they will escalate and what that will move on to. So it's no way a judgment on you, but you can clearly see that the funding streams to put in place support for young people has evaporated over successive governments over many years, and there is less and less every year for young people to give them opportunities so that they then don't commit crime, because they just don't exist. So I'm interested to see when you said how we measure success, because how can we actually identify how we don't measure success? And by not getting funding, is that a way of actually identifying that? Can we put in negatives where there are negatives? Because the fact that we don't give young people money and places and youth work support over many generations has led to this catastrophe. In other areas, and I know Bath and North East Somerset is not one of those key areas, But in other areas of this country, it is a catastrophe for a huge number of people. So I do think that we need to identify the lack of something as one of our measurements of success, because if we don't have something, then that's important. Going on further, back to the online safety bill and phones. Again, this is not picked up in this document, in other documents. This is key to young people. Young people, as I've said, from the age of 6 or 7, have phones. How they use their phones is very different. I'm sure we were all aware that when we were young, we walked into a newsagent, there was a top shelf. They don't walk into a newsagent and see a top shelf anymore. They sit in their bedroom and it's there with them and everything that follows through. We had very little safety and teachable moments about how you use your phone and what you do with it, and how parents can even support children in that process. So going back then to violence reduction, people are seeing a huge amount of imagery that's live and real and happening in real locations rather than just movies and online, that they can do through their phone, and how that's exacerbated. So how do we measure success of looking at those issues? And then I come back to sport too. I noticed that in that document they talked about Sport England and the access to that. So again, can we get some demographics of what groups of people are getting access to sport? And again, it was interesting that they said in that document how there was a real moment between pathways of moving from school, from junior school to secondary school, where young people often fell out, and that sport becomes a really important element of that space. And again, there are very few opportunities for certain people to get involved in sports that aren't football, rugby, competitive sports, and how do we support how do we support young people in that? And so I guess that's my, again, asking that measures of success. So I'm sort of having a little rant, I get that, but I also recognise that there's much to do.
Thank you. I mean, you make some very powerful points, and discussing those kind of issues is what we're going to be doing in the months ahead. Serious violence, there are many kinds of serious violence and there are many root causes, and so it depends on how big we want the focus to be on serious violence, or whether some of those issues we're going to be addressing through our wider prevention and early intervention strategy and the work of the partnership there. I think certainly online safety is something we do take seriously, and we've recently attached some information about that. We're trying to build some resources for parents on our web page as a look-up, and I think we need to do more about that. There is more to be done there. The teachable moments, we have been looking at a different kind of teachable moments, but looking at people attending and admitted to hospital with knife crime injuries, and how we can use that as a chance for people to reflect on what's happening, what they're getting into. We haven't been able to make a start on that yet, but it's something we have been talking with the RUH about, building on what's happening elsewhere. You mentioned exclusions, and that is a significant part of our work. Last week we held our second Violence Reduction Unit conference for professionals, and took the opportunity there to invite someone to come and launch a toolkit that's been developed to support schools with different approaches to supporting children who are at risk of exclusion. And that project that was run really briefly through the Violence Reduction Unit worked with a number of individual children, and none of them went on to be excluded. So there was some real learning there. And youth services, yes, I mean, how valuable they are for all children, but particularly for those that we're thinking about here, perhaps in more vulnerable groups. We actually receive a very small grant through the Police and Crime Commissioner. It's just over £100,000. And out of that, we're required to pay for our staff, which is a full-time coordinator and a part-time support worker. So there isn't very much money in there to procure services. And I wouldn't want people to think that we're going to be a channel for lots more resources. I think we need to be working with partners to influence what's done and how it's done. But we have been able to purchase some detached youth work through a collaboration between DHI and Youth Connect South West. And they do go out in our areas that we recognise perhaps is a greater chance of difficulty for children, where they may be at risk of grooming, and where things spark between children and there's peer-on-peer violence. And they go out and make contacts with the children, begin to form relationships, signpost them to services where they can, and just be a trusted adult presence that perhaps helps keep that area a little bit safer for a little while and helps us build our understanding of what's going on in our community. But there's so much more that could be done.
Thank you. Kevin.
Thank you. I suppose my confusion started when I read 3.8, what the three key metrics were, and thinking that was the only thing you were going to focus on. And then I was then raised a lot of questions around whether it's domestic violence, sexual health, youth work, etc. And I know then you mentioned in your PowerPoint presentation that you can put local metrics under this. I just wondered, would you be providing us with a whole overview of what your metrics will eventually be? Because at the moment you seem to have a lot that you're considering, but have you decided on them? And when you decide on them, is it the Police and Crime Commissioner that ratifies those and then funds appropriately those? And if you need to, can you then go back to them and say, we're short because, look, we're doing this and this is what it shows? Is that going to be the vehicle to get more funding? Because I'm just a little concerned that when you're saying Bath and North East Somerset has a lot of other things in place, which is fantastic, whether those will be funded or focused on because they're not here. Does that make sense?
I think so, yes. It's not for me to set those metrics. It is for that very wide partnership. And I will have a voice in it, but we need to consult, we need to listen, we need to understand how people want to measure, or really where we focus and how we measure. We've to date focused on children's involvement in street violence. We have supported a little bit some domestic abuse programmes, one for families, and we're just talking at the moment about introducing a lived experience mentoring scheme which will offer support to some who've been harmed through domestic abuse as well as others. But we don't have a lot of funding, and I don't think there is very much chance of obtaining more funding. So I don't want to raise people's hopes. I am very sorry. It is much more about how we influence, I think, other initiatives and how we come together to identify what our priorities are, because we're not going to be able to do everything. There is a well-established domestic abuse partnership, and now under the Domestic Abuse Act they have a legal definition and some key areas of work that need to be done to respond to that. I think there is an opportunity for us to revisit whether we count domestic abuse, addressing domestic abuse as part of this agenda, but there are very clear governance arrangements already in place for that. So I wouldn't necessarily see the Violence Reduction Unit and its successor taking that on. But there are other areas as well, violence against women and girls, serious sexual assault. We need to consider whether that's going to be part of our agenda going forward. And I think the guidance even talks about serious violence in the community against property. Was something I hadn't really considered, but it is just very much for the local partnership to agree where is it going to focus and how is it going to measure success. I'm keen that we do that at a Bath and North East Somerset level, and at the moment each of the 5 local authorities has a slightly different focus, and my understanding is that will be the same going forward. So if there is something particular that we want to do or want to include here, I don't believe it will be for the Police and Crime Commissioner to say, no, we all need to be doing the same. It will be very much a local agenda at the end of the day.
Yes, Kevin.
Can I just ask then, when might you have the menu of what you've decided on that will you present here, or to actually, this is, because obviously the next bit we're going to hear is about the schools and the strategic evidence base around exclusions. And obviously the work there's been a lot of papers and things written around exclusions and then vulnerability and then all the things that flow from that. So when will you have something that you will present here? Say these are going to be our metrics, because again what I'm concerned about, and possibly Joe hinted at this as well, is that if you're measuring something, you have evidence there to throw back at somebody else, whether it's the police crime commission or somebody else. If you don't have that evidence, then you're liable to either say, well, it's not worthwhile looking at, or the impact hasn't been measured, or we don't really know, and then it becomes difficult.
Before you answer that, we're a small authority with a relatively small crime rate, and so statistically that could change. We could have something untoward happen in one part of the authority that sways your intentions completely. So whatever you categorise, there won't be permanence to it. It will change according to events. Am I right?
Yes, our approach needs to be dynamic. And we work closely with police, and so we do understand what intelligence is coming in, where they are seeing as the latest so-called hotspot areas where there are concerns. And we do need to be guided by that, because we can't spread too thinly across the whole authority.
And there is also the very slow inclusion of public health. Public health, to win any battle that they engage in, is a very slow process, and as it's suggested on your slides, it could be several generations. It's taken a long time to alleviate the problems around smoking. It's gone to a good effect, but when it was first initiated, it was looked on as something. It wasn't well received by the public, because, of course, the majority of the public were smokers. And how that interprets it, and what Joanna says about mobile phones and that, for children, there is no escape now. If they're subject to bullying, they only have to phone them in their bedroom and say, I'll get you in the morning, so to speak, and they don't sleep all night. So it's a big concern, I think, that the advances in technology have their quite considerable disadvantages, especially for youngsters, because they know absolutely no difference.
No.
Sorry, I may have swayed you away from Kevin, but I was trying to follow on from what Kevin was saying.
Yes, and I do agree, and we do see, mobile phones are also the key vehicle through which children are groomed and involved in county lines activity. So, yes.
And speaking with the police only recently, they just say they've terminated the actions of 3 county lines to date, just as of relatively recently. But of course, one comes back. So it's
again, we don't seem to have very many operating in our area compared to other areas. No. We don't completely understand why that is, but it's no cause for complacency.
No.
Shall I come back and try and answer your question when? The only real deadline we've got is 31st of January next year, 2024, when the strategy needs to be published. So we will need to build in all the markers along the way for us to get to that point. We have recently participated in the latest Avon and Somerset Strategic Needs Assessment, so they've collected information and data from us. That is a completed document. I'm not sure whether it's in the public domain yet. But the next thing we're asked to do as a violence reduction unit is our own strategic needs assessment, and Sophia is currently working on that with partner agencies. And out of that will come our strategy. So we need to be guided by what are the latest concerns we're recognising, what are the continuing trends, is anything changing? We do need to consult widely. I be guided by members of this panel or maybe by Mary as to, when to bring something back, but I'm very happy to do that.
Any more questions? So really, it's how you develop this, because you gave a number of considerations on your slides of where this could sit, under what governance it could sit.
Yes, that's taken from the guidance. We did take the question to our senior leadership team in the council a couple of weeks ago, and the steer there was to follow really what's in the guidance and build on the existing partnership. So I think as a council we'd be looking for the Police and Crime Commissioner to convene the partnership. They don't hold a duty in their own right, but they are well placed to pull things together. And they have also got a certain amount of set-up funding that we may be able to benefit from. We're still talking with them about how that will be used. But I think that's the preference for Bath and North East Somerset. And certainly that's what I'm seeing across the other 5 authorities. I think everybody is going to be happy with that. But of course we have other partners who have a different kind of footprint of their sphere of responsibility. So we don't have co-terminosity with fire and rescue, with our integrated care board. So we are also going to need to hear from other partners, and we need to let the Home Office know by the end of March. But I imagine it feels like it will continue to be the Avon and Somerset focus, with a BAMES particular.
And because we have relatively low crime rates, statistically, we only have to have a couple and it throws us out completely, doesn't it? And does that work against us? How will that be received by the powers that be?
The duty applies to every area, regardless of reported crime. So these are still priorities for us and priorities for our community safety partnership. I'm not worried if our levels are low. I'm very pleased about that.
Absolutely.
And I think our challenge is to keep them low and lower if possible. I think there are opportunities to focus on and do some really effective work with individuals, because we're not dealing with hundreds and hundreds of people. So it's a good thing in many ways. And the Youth Justice Service that works with some of these children is able to bring to bear a trauma-informed approach and really work carefully with them and their families to see what change can be supported.
Right. It's just that I don't know if I should embark on this, but I saw a recent presentation by the Police Crime Commissioner, and he came out with lots of statistics, but no original figure. So you can turn around and say something's come down by so many %, but without the original figure, it's meaningless. And it causes a lot of doubts. And I think that if we're clear on the situation, what it is, and we get a true and accurate interpretation of what it is, you get a much better receptive audience to that. Else it confuses.
It is a big piece of work to bring together data from that wide number of organisations who hold and collect and share data in different ways. I think the intention is that because there's an annual review, we will be able to look back at least on the last year, and over a period of time we should be able to pick up on longer term trends and patterns.
Yeah, we're all glad that our crime rates are very low, and long may they be maintained. So good for you. Kevin? I'm sorry, beg your pardon. Andy, I'm looking through you.
It's very easy to get Kevin and I confused. I can see why that might happen. My question is, well, it's a comment really. I found this quite a difficult report to get my head around, because a lot of it seems to be aspirational, and you are putting a strategy together for January next year. I understand that. So my suggestion to the chair really, and it's difficult because we're coming to the end of this term, but it seems to me it would be very helpful if you could come back sort of at the end of this year, so that we know, because I appreciate that you've got £114,000 and it's a very big task that you've got. So, we're all saying, well, you should be doing this, and this, but frankly, you're not going to be able to do an awful lot with that sort of money. So I'd just like to know what you're going to do, so please can you come back when you know?
Absolutely.
So actually that's a good way to round this up. We have to have some continuity, and it goes through, with that responsibility goes through to the new administration after May. And the recommendations here are to a series of noting, so I think we can take those as read. Mary, you wanted to...
May I also, Chair, suggest that we take a report back in September, so we could give a progress update in September ahead of where we are in terms of the new duties coming in for January, and that will give panel time to scrutinise where our developments are at that time.
And I'm glad you actually mentioned a date so that we can actually keep to that. So Sally, thank you very, very much. Thank you.
Thank you.
So we're going to move on now to item 12, and this is the education performance 2021-22, and if I can invite Chris Wilford to introduce the report. Chris, please.
Thank you, Chair. If I can just move over there for a minute.
Everyone, yeah.
You've gone over there. Thank you. Thank you, Chair, for the introduction. So I came in November, I think, and I gave you some preliminary outcomes, particularly at primary. We didn't yet have the secondary performance for 21-22 to present, and what we agreed is that we'd come back when we've got a little bit more information on our data for the year, and we'd try and summarise that. And more importantly, when our data team's been able to pull together results and examine it in more detail. What I will say is what is in here can be quite detailed, so I'm going to try and summarise it. But if there isn't anything in there you might want to see or expect to see, you can let us know and we can go back to the data and can look at it and see if we can cut in it in a different way. So what you've got today are two things. One is my report, which is a summary of the slides that are in our strategic evidence base. And I don't know if you've had the opportunity to click onto the links and have a look at the strategic evidence base, but there's a lot of information in there, not just about education, about all sorts of other areas of life and what it's like in Baines and what data and information tells us, which will inform all sorts of things, not to say the least, the public health strategy as well, which was produced later as well. But importantly for me, there is a section in there in education. So in my report, I've just tried to pull out some of the key themes, and I'll pick these up as I go through the presentation. But I suppose the first thing I just wanted to say is, there's a lot of reasons to be really positive about Bath and North East Somerset and the schools that happen in Baines. There are a lot of very positive results for some children in Baines, which should be commended and should be applauded, and children do well in our schools. Our schools generally perform well, and there is a lot of, if you like, inward attraction for Baines in terms of its education. We do attract people and families here for it. But as you'll see as we go through the slides and the information, that doesn't represent all children in Baines. For some children we do need to try and do better, particularly when we compare them to their peers in their educational settings. So I won't go through every slide in detail. I'll try and pick out the key points and just try and summarise what our data is telling us, and then you can ask me any questions we go through in the end. But I don't know if you've had the opportunity to go onto the website. You can click on any of these tiles, and it will take you through to the different parts of the presentation. So it's quite useful if you particularly just want to get to exclusions, or if you want to get to Key Stage 1, which is presented in this way. And I think it's the first time we've presented it and summarised it in this way, or the data team have. So if any particular feedback about it, please let us know. But I'll just skim through some of it and then just try and pull out some of the important is. So we've obviously got some information about pupil numbers in Baines, where they are, where they go to school, and where what stage of their school education they are. An interesting thing about Baines is obviously we've got quite a large independent school population compared to other regions, with 40% of children attending an independent school, on the twice national figure. A little bit about our characteristics and education inequalities is up there for your information as a summary introduction to what we're seeing in Baines, and I will pick up some of this in a bit more detail as we go through the slides. And again, that's broken down by key stages, so you can see where children are in Baines in relation to their characteristics. There's a really important bullet point in there at the top about our disadvantage gap, which I think is worth holding in mind as you start to throw questions at me towards the end. So starting at early years, so when I presented in November, what I will say is information I gave you about early years and primary attainment in November was broadly accurate. There have been some changes in the data that was presented today. More positively, there is some changes in Key Stage 2, which back in November, when we looked at the data, first of all, was looking like it wasn't quite as positive as it could be. Pleased to say that has improved. I think that I will say about the early years foundation stages, obviously there have been some changes in its implementation and how it's assessed and how it's monitored and how the data is collected, so you're not necessarily looking like for like when you look at any previous years. So comparing to previous years isn't necessarily useful. What's positive is that Baines in the early years framework is doing really well in overall. The percentage of children with good level of development is above national and regional averages, and expected levels of gain is also above national and regional averages. There is still a persistent attainment gap between those children who receive or are eligible for free school meals and their peers in those early years settings, which looks, again, quite wide and wider than the national average, which I'll talk through in a bit more detail. But overall, for children in our early years settings against GLD, the performance is good. Again, Key Stage 1 and phonics. This isn't too dissimilar to what we presented to you in November. So what we're seeing here is a fairly strong set of performance in all areas, in the writing, reading, maths and science. Meeting the extended standard is higher than it is in the southwest and higher than it is in Baines. So again, a positive picture in Key Stage 1. Key Stage 2 is a little different. So if you looked, particularly if you wanted to look back at 2019, which is, I guess, the last comparable set of data, this is where perhaps we've had the biggest change in terms of how we were previously doing in those areas in terms of expected standards in reading, writing, maths combined, if we're looking at that as a measure. When we came in November, actually, this was actually still looking worse than Southwestern national averages, which was a bit of a surprise. Because back in 2019, if you looked at our data from purely percentage lens, then we were doing much better than we were. That has changed, and our Key Stage 2 data is now looking slightly better than Southwestern regional averages. So again, some positive messages to be taken from there. what you can see in this, this to start in the early years as well, you also see that an ongoing pattern that girls outperform boys in all of the key stages in most of the outcomes, although that has slightly narrowed a little bit in key stage 2 this year. But lots of reasons to be positive. Again, that isn't consistent for all children in Baines, and I'll talk about that as we carry on. So this is key stage 2 attainment by pupil characteristics, and this is why things are a little bit different in Baines. And if we talk about a little bit now, and I'll come back to it as we get further on about that attainment gap, particularly for those children who are eligible for free school meals, it is this year in key stage 2 in terms of the academic results. It's most stark in key stage 2, where it's definitely widened than it previously was in 2019. And SEN as well is a slight decrease, but not as comparable to free school meals. So not doing quite as well as national, but nowhere near the gap with free school meals. Key stage 4, so we didn't have this data to look at last time, and there is strong notes of warnings from the DFE about how you look at this data when you go back to the previous years, simply because of the way that exams were set in previous years. But what you can see in terms of achieving good GCSE results, higher proportion of grades 9 to 5 in English and Maths, it's looking really positive when compared to the Southwest and with England. So some really strong results last year in our secondary schools, which is good. And also the average attainment 8 score is higher than Baines than the original, so that's the average grade across 8 subjects. It's looking really positive in Baines as well. So lots of reasons to be positive. Again, however, if you start to break that down and look at pupil characteristics, you can see that there is a gender gap there, not as stark as it was, but obviously girls continue to outperform boys in key stage 4 as well. The disadvantage gap, so that's those children who were eligible for free school meals in the last 6 years, plus looked after children. You can see that has widened slightly. If you look to the slide to the top right, to the graph at the top right, and below that the free school meals gap there as well, you see that remains stubbornly persistent as well in key stage 4 for those children who have got free school meals. Positively, our SEN outcomes are starting to look better and in line with national and regional averages, and the gap there isn't there or negligible in key stage 4, which is really, really positive, and actually echoes something I said back in November. Was anecdotally what I was picking up from, particularly from secondary schools, is that there was a feeling that children with SEN have done well in this year. So that's a real positive to be taken, particularly after the last couple of years those children will have had in the lead up to their exams. And again, by attainment 8, again you can see it's a fairly similar picture in relation to gender, in relation to disadvantage, free school meals, and again more positively with SEN. That's starting to look really positive in key stage 4.
Are we doing questions as we go through, or are we waiting to the end?
Do the question now, and then we'll get it.
Yeah, I mean, the reference to the free school meals, it's quite a clunky measurement, really, because those numbers that we use, is that the data of those that we know are eligible for free school meals, or is that the data for those that actually take it up? Because as we know, there are some, and also there's a part of the mechanism is if someone just happens to go in a dip of circumstances for a very short time and then come out of that, so then they don't really need it, they are still included in that number for a period of time. And I'm quite focused on there is a grey area just to be above that qualification for free school meals, where when they go through the assessment, albeit for a few pounds, they don't qualify for free school meals, but the reality is they are still within that cohort. So we put a lot of emphasis on free school meals, but it's quite a foggy piece, I think, in actually getting any true representation of what it actually really means.
So it's the eligibility as opposed to in receipt of. So it's the eligibility.
And the take-up. I mean, are our figures, do we know from the DWP that that is the number of people, or is it we're going on just the take-up?
The eligibility for those children in the year who are eligible for free school meals, as opposed to the take-up.
And that's irrespective of take-up?
Yeah.
So we know it. Okay.
But that's a national measure, so it's not just something akin to Bain. So that's how, if you like, that's how it's being measured across the country.
Okay, thanks.
But I absolutely take your point about, that those children who are just above the eligibility, those children who are perhaps struggling financially, particularly in more recent years, particularly in the last 18 months, the last 12 months.
I presume there's no data to indicate those ones that are just above the line, if you like,
no.
by a small percentage?
Not that's collected.
No, okay.
Can I just ask, has it changed around the fact that schools are funded on the take-up as opposed to eligibility?
The collection of the data is on the eligibility, not the take-up.
The schools are funded.
Oh, yeah. Yeah. Shall I? Yeah, thank you. A bit about the progress. So you can see that from key stage 4, more pupils in Bain made an average more progress, around 30% of the grade, than other pupils nationally with similar attainment to key stage 2. So that's a slide about where they were in key stage 2 and where they were in key stage 4. But again, you can see that there is some changes by pupil characteristics, with girls making more progress than boys, and less progress, particularly in the disadvantaged cohort and those children eligible for free school meals. Key stage.
Let me just ask a quick question. Now, so it's about progress at key stage in the early years, key stage 1, 2 and 4, and key stage 3 is not included, and I suppose that's because there aren't any sets of exams that all pupils are expected to take. But is there any data that's sort of recorded or in this way, or is it only going to be internally in the schools themselves?
The schools will obviously have continuing assessment and information about how children are doing through those years, but there's nothing that we collect from the schools. There's nothing that the DFE collect that.
Because it's quite an important stage, isn't it, really?
Yeah.
Also because at the end of key stage 3, the big decisions are made about which subjects to carry on with and which not to carry on with. But, but there's no prospect of including that then, not really easily. Yeah. Right.
Well, no, not very easily.
No.
and not without getting rebuked by a lot of head teachers. At key stage... Sorry, Rob.
Yeah, I just really want to pick up on one specific area, and that is the number of children with care plans. And by the summary, it's over doubled in the last sort of 5 or 6 years, like this. And my interpretation is that these care plans come with quite a significant resource requirement. And so, although we've identified that we've got 1,700 odd children with care plans on there, do we know the number of children that are actually waiting to be assessed and the time it's taking to be assessed? And is that time taken to be assessed being managed because of the resource implications that may arise from any assessment?
So we have had a big increase in the number of education and healthcare plans in Bain, particularly since 2019, and during the pandemic the number of requests went substantially northwards. The timeliness of the assessments has been impacted because of that, but not because any resources are necessarily being throttled. It's because actually each assessment will require input from a speech and language therapist, from a occupational health therapist, from an education psychologist, and they are skilled. They are professionals which are a skill shortage of and hard to get hold of. So there are some delays in the timeliness of those reports. We don't necessarily hold a waiting list, if you like, for people at the point of assessment. If they're accepted by the panel for a needs assessment, we'll kick that off straight away, and there will be some work we can collect from schools, there'll be some work we can collect from parents, there'll be some work we can get done by some assessments. But towards the end of the pandemic and coming out of the pandemic, there was a real issue with getting access to certain advice in a timely way. That is improving, and timeliness is improving. The requests are starting to slow down for needs assessments compared to where they were, particularly in 21, where it's a significant amount of number of requests. So I do expect to see timeliness go up. There have been some more resource allocation, particularly from our health colleagues, into occupational health and speech language, where there were some backlog and delays in contributing to those needs assessments.
Yeah, I'm just really looking for some assurance that I appreciate that when assessment is being done, sometimes it is a time-driven piece because you have to wait and see behaviours over a period of time, something like this. But also I'm looking from maybe the family's point of view, that while they're in that period of waiting, everything like this, there are some real concerns and challenges that are happening, not only obviously to the family, but also to the school that particular child is in, because it's still displaying whatever behaviours that child behaves, which obviously then has an impact on not only the school, but obviously the class, etc., etc. So, but I'm just really wanted to raise it, that I see this as a significant challenge, and are we as timely as we can be in getting these assessments done?
So our timelines at the moment, so we have 20 weeks to complete an assessment from start to finish. 20 weeks from the point where we say do it. Prior to 2020, our timelines was always between 80 and 90%, so we got that done. Sometimes an assessment takes longer for that, but sometimes that's for very good reasons. And that might be about a parent who wants to make more time to comment on a draft report. There might be a request for specialist reports. Our time list during the pandemic was quite significantly hit. Our time list at the moment is up around 50%. And some of that has been about the volume of demand, as opposed to the will and the want of our staff to want to be able to deliver that, and access to the professionals to be able to be involved. We were particularly hit at one point with capacity in the EP service, education psychology, and with occupational health. But that capacity is improving. It is a national issue. It's not akin to Baines. It's an issue that's been felt across the country in terms of recruitment of OH and educational psychologists. What I will say is our timeliness, while it's not where it needs to be, it's not delaying much beyond that. So a much higher percentage of plans are delivered in week 21, weeks 22, weeks 23, but obviously we would want to do it better than the 20-week timescale. You're welcome.
Just to clarify something, sorry Chris, a point was raised from a trust point of view the other day that they were trying to get an educational psychologist to support in the assessment, but the authority would only allow the local authority educational psychologist to do the assessment. Is that the case, or can the local authority have a recommended list of those other EPs that may or may not?
Not for the assessment. So for the assessment piece, if you watch the LA does, we are the, if you like, the commissioned appointed psychology service to deliver that assessment. So we do get that question at the times where a school might want to use their own psychologist to pass that assessment, or they might want to use that, but actually it's prescribed through the code practice that the LA appoints that educational psychologist. There will be periods outside of that, not periods, there will be circumstances outside of the assessment, so a school might ask for another report to be commissioned by another education psychologist, and our EPs will always look at that. They'll always take that into board. They may have a conversation with that education psychologist, but during the assessment period it will always be an LA appointed EP who conducts that assessment.
So the LA wouldn't consider appointing non-LA employed?
Okay. We would and do have to use at times locums and agencies, but we've appointed them to work for us. So we wouldn't necessarily say if the school said we found this psychologist, they'll do the report. We wouldn't go with that. Key Stage 5. Again, there's a lot to be proud of our students in Key Stage 5 in Baines as well, a really strong set of results. And again, girls doing much stronger than boys in that area. Don't have any data in there from the team, particularly around the pupil characteristics at the moment, but we may be able to get that. So I just wanted to focus on that free school meals attainment gap because it's something that has been prevalent in Baines for over 20 years, ever since I've worked in Baines. The gap's been there or thereabouts and changed a lot. And this slide, you can't see it well enough up there, but the 4 bar charts on the left are quite interesting. I think if you look at that, you can kind of visually see where the gap is from the different key stages, the different ages in Baines. Yeah, so the dark blue bar is Baines free school eligible. The light blue bar is Baines non-free school eligible. The burnt orange, I am a little bit colourblind, so I'm going with burnt orange. So the third bar across, burnt orange, is England free school meals eligible. And the skin tone, or I don't know what that is, England non-free school eligible is the non-free school. So what you can see, if we just look at age 5, the one on the left, you can see our children, the light blue, in terms of their attainment, that age range, significantly outperforming national to the 75. And you can see where national is at 69. And then you can see that our performance for our free school meal cohort is 47 and the national is 49. So our gap, because of the performance of all of non-free school meal children, is so high, even though our performance of our free school meals children isn't that far behind the national average. The gap is there because children, their peers, so the other children they're going to school with, are doing so much better. And that's the free school attainment gap. And what you can see through the key stages is that continuing to widen through age 5 to age 7. But then in this academic year that's just gone, you can see it's significantly widened, if you like, in key stage 2. And that's the worrying trend, if you like.
When you say about how you level out that or the attainment gap, and you're saying because obviously the top end are performing better, which is fine and good. Do you take it from a top end, or do you take it from an average? Because obviously there's going to be a difference there, isn't there? Really?
Yeah, I'm not the data analyst, but I think it's an average.
It's average. Yeah.
I think I can clarify that. I did ask if one of my data colleagues would join me for this, so they could help me with a tricky question. But you can see, by the time we get to age 11 in Baines for the year that's just gone, particularly key stage 2, that gap, if you like, widens. The interesting thing is, if you get to by the time you get to key stage 4, what you can see is that it narrows. And actually, if you look at the performance of our children in receipt eligible for free school meals compared to children across Baines, across the rest of the country, their attainment is in line. It's the same as children across the country. So it's not that they're doing poorer than children comparable across the country, because they're not. It's just in comparison to their peers, or how their peers are performing, they're not doing as well as those children are across the country. But that is because children in Baines are doing significantly better than national and regional averages. And that's the attainment gap. And I believe the aspiration for the local authority is actually those children our children in the same schools should be able to achieve as well as their peers. So I just wanted to focus on that because I think it's quite interesting. I'll move on because I'm conscious of time and I'm sure there'll be plenty of questions, but just talk a little bit about school attendance. You will have seen quite a lot about persistent school absence in the press recently. I think there's been quite a lot of attention on it from the DFE, and there are some stories about whether we should remove benefits for parents of children who are moving those things lying around. So the positive thing in Baines as well is, at the moment, whilst we did have some impact on the attendance levels in Baines pre-pandemic to where they were, they still remain reasonably strong in comparison, and persistent absence in Baines remains relatively low compared to South West and regional avenues. So that's something positive about school exclusions. This has long been an issue in Baines, not necessarily around permanent exclusions, which go up and down all the time. Sometimes it's a good year, sometimes a year where it's particularly poor, but what is now called suspensions, which we would previously have called fixed-term exclusions, so short-term suspensions, has always been statistically higher in Baines than it has across the regions. And particularly if you start to look at it by characteristics, you will definitely start to see that there is some patterns, particularly around SEN and around ethnicity, where particularly black children, children of dual heritage, experience proportionally more suspensions than their peers do in Baines. You are looking at a very small percentage of the population overall within that. In permanent exclusions, that doesn't... Liz, do you want me to... No, go on.
I'm so sorry to disturb you, but I've been waiting for this to come for quite some time because it does actually really disturb me that the permanent exclusions, they're still, for 16 young people, but it means, a real dampener on their future. If they are permanently excluded from school, they have to be found at, some sort of education, some sort of provision elsewhere. And I noticed that the suspensions, we did always call them suspensions.
They were before, weren't they? Yeah.
The suspensions, again, are fairly high, and that is quite worrying. A couple of questions. Firstly, do we, as an authority, have any say in the permanent exclusions? In the old days, pre-academy, we did. We were called in. It had to go before the local authority, education authority, and there had to be a case made for a permanent exclusion, and the fallback was schools were penalised with money, etc. Now with academies, are we involved in any way? So that's the first question. And secondly, there's obviously a conversation between what Sally Churchyard was talking about violent crime reduction and the violence reduction unit, and these many of these youngsters who come from disadvantaged areas, deprived areas, or they are greater represented from the point of view of their ethnicity. There's a conversation there that we ought to be having in some way, and should the local authority should Baines be part of this conversation about violence reduction, because there must be a correlation between these youngsters who are either permanently excluded or suspended. And then I know that as a virtual school governor, as soon as there is a suspension or any kind of permanent exclusion, the virtual head teacher is in there arguing the case, and so has greatly reduced the no looked after child has been permanently excluded for the last 3 years, and the number of suspensions of looked after children has gone down. So do we have a role anymore, or do we just take the details and the statistics and produce them? Thanks.
So first question was about role and responsibility of the LA. Second question was third question was
conversation between the violence reduction unit and the local authority regarding education, because there has to be a significant link here. And should the local authority, when they mentioned partners, they didn't mention, our education area, has been involved. It was the probation office, the police, etc. But education wasn't mentioned, and surely this must be quite a significant part of what's happening to some of our young people who are involved in serious crime or who are involved in street crime, that they're roaming the streets because they've been excluded or suspended.
Yeah.
And then the last thing is, do we do anything, can we do anything to stop these permanent exclusions, stroke suspensions, in that the virtual school has a very big role to play and has certainly hugely reduced the number of permanent exclusions, none, in the last 3 years, and the number of suspensions, because they go in and argue the case for the youngster. I assume there isn't a role for us in that because of the fact that most of our schools are academies.
So the first one around the responsibility, so some of it has changed since then, obviously, because the local authority used to look at all the exclusions because probably at the time they were maintained schools, and we don't. It is the responsibility of the academy of the trust to set a disciplinary panel following exclusion, and it is the role of that panel to scrutinise the decision of the head teacher to permanently exclude. And what there should be, so this panel, initially the first panel is made up of the governors from the school, or members of the trust body will look at their exclusion. And there's quite clear exclusion guidance from the DFE, which we provide to all the panels. So once there's an exclusion, it goes into our attendance and welfare service. They'll look at what information is provided. We will look for an exclusion pack from the school which demonstrates what have they done, and we will provide written advice to that governing trust body to say this is what we think about what's been done, what's not been done, and what questions could be based on what the guidance is from the DFE.
We aren't involved in the panel, but we do advise the panel, and they can take or leave our advice, so it doesn't matter what we say.
They can do, but we can also provide parents with advice and information, so we have conversations with parents and information, both from the Attendance and Welfare Service and from the our SEND support. I've forgotten the name, they've changed the name recently, it's gone. Our SEND advisory service will provide independent advice. They will, if sometimes, provide someone to go in and join that panel. The parent then has the right to request an independent appeal, and the independent appeal can be set up by the school. The school can set that up within their own trust. We offer that service through our Democratic Services office, so quite a lot of our schools will buy that in from our office, so a panel will be made up which is truly independent, and quite often that panel is made up of lay people who are trained in legislation around exclusion. So I know, for example, one of our solicitors will sit on that panel when called, and that is their job to scrutinise the evidence provided to the school. So there is a thorough process, but it takes a lot of effort by a parent to challenge and to continue to do it, and I think that's where some of the difficulties lie. We do speak to schools about exclusions. We have overturned exclusions in certain cases. So we still very much do have a responsibility to scrutinise. What I'll say about exclusions in Baines is I say whenever I do it, secondary exclusions in Baines are too high. For the last few years we've had no primary exclusions. But if you look at the population of children in Baines who are in alternative provision because of exclusions, it's very low. What tends to happen in Baines was that once a child is excluded from a secondary school, they will provide education during that period until the decision to uphold or not uphold is made. Once that is made, if it's upheld, we will start to continue obviously to provide them with education, but we will ask for their case to be heard through what's called fair access, and we'll ask for that child to be returned to mainstream education. And where we do well in Baines is our behaviour and attendance panels do return children to a mainstream education. And we have a very small population of children who end up finishing their education in alternative provision, which can't be said the same of a lot of other areas around us. And I think that's a better thing. I haven't answered all your questions.
Sorry, this is just carrying on. I mean, are you saying that because the provision in Baines for alternative education is very small, does that compensate for the extra numbers of exclusions?
No, I think the processes we've got in place around what's called fair access are very good in Baines. So all the secondary heads, particularly, and I'm talking about secondary heads because that's tend to be where a lot of the fair access decisions are made, will meet in what's called a behaviour attendance panel, and they will be presented information about a child who's in need of a mainstream school place because of exclusion, and we will have a point system which will determine what school should then take that child to go in. In some LAs, that process is very challenging and very difficult, and local authorities quite often will have to go to an adjudicator to get a school to make a decision. I've only been to an adjudicator once whilst I've been in Baines. So what we find is that secondary schools will say, actually, we'll give the child a chance, we'll take the child on. Whether that helps because the provision is small.
Why do you think, therefore, there are more exclusions, permanent exclusions, in Baines than there is in an equivalent authority elsewhere?
I guess there's a bit of a question linked back to about actually why do we think we've got that gap around free school meals? Why have we got that? Whether there is a particular issue around inclusion or behaviour support, or in Baines in some schools is a discussion that we constantly have with, particularly with secondary schools. It's a discussion that's on the School Standards Board again next week to raise the issue around secondary exclusions. Do you want me to?
I think so sometimes the governors of schools, whether they're academies or not, come under pressure from parents and teachers sometimes to exclude pupils because of their behaviour or whatever. It struck me when Sally Churchyard was talking, and just now we seem to be having this big issue about exclusion from schools and violence. And just say, what do we have, 6 secondary schools now? And we can't be talking about a huge number of exclusions that we can't track back. And I would suggest that most exclusions, or a large number, do not involve violence, and those who are excluded do not necessarily go off and become involved in criminal activity or behaviour. Most of them will go away and be reallocated to school somewhere else, or come back to the school that they were suspended from, and with the support of the school and their families, they slot back into education. Let's not build it up into this huge big thing that is causing a massive problem. I think you're saying you can have a look at perhaps why there is slightly higher level of exclusion, and that's worth doing. It's always worth asking the question, but let's not reinvent the wheel. Exclusions and suspensions have been around a long time, and I've sat in on enough myself over the years, I have to say, and they are not easy, and they are very, very difficult, and I think everybody is aware the impact that they can have on a young person's life.
Yes.
Jerry, what I was trying to intimate was that there's obviously some sort of link. It's not a massive link, but maybe the education should be involved in looking at serious crime reduction. I too have sat in a number of exclusions as well. So I wasn't saying huge numbers of children who are excluded are roaming the streets, whatever. I'm not saying that. But I just think there is a conversation that should be
sorry, Councillor Harman, I didn't get to that part of it. I just want to reassure you that the conversations about the violence reduction unit and what we do is very much across the work that Sally does in education. And last year, year before last, and into about a bit of last year, the violence reduction coordinator funded an education post, who was, when Sally talked about that pilot around intervening and supporting children at risk of exclusion, that was a post that sat in my area, which was funded by the Violence Reduction Unit, and did 2 things. One is rewrite guidance for schools around exclusions, and did a lot of talking to schools about exclusions. but also intervened in individual cases. So it's just to provide that reassurance that we're linked across. And we continue to look for opportunities to work. And the role of the virtual school is a fantastic example, I think, Liz, about that dedicated function around a population of children. And we are looking through the extended duties of the virtual school to have that same approach to our children in need, children and child protection plans, to be able to support them in the same way around exclusions. What I will say is there's quite a lot written in statute and law about looked after children and their education, where there isn't for those other groups of children. School Ofsted ratings.
If I could just add to what Chris is just saying, also across the service we've got a workshop at the end of January where we're looking at that disproportionality in terms of overrepresentation, so across the broader children's service, so again that we maximise those opportunities to intervene as quickly as we can. So just to add to what Chris has given, so some further assurance.
And just the final slide, I think, in the SEB is information about obviously the Ofsted inspections, which are happening across Baines. And it's just worth noting that under the new inspection framework, which came in just 2 or 3 months before the pandemic, there is obviously a lot of the inspections were postponed due to the inspection, but inspections have started again, but they haven't. There's quite a backlog, so the rate of inspections in schools isn't prolific. There may be head teachers quite breathing a sigh of relief about it, but they are very much going in and around Baines at the moment. We haven't, we continue to enjoy good schools in Baines under Ofsted, but it is very difficult now to receive an outstanding judgment under the new inspection framework, and a good is a very good.
One of the things I wondered is why no schools are outstanding. What's happening?
I think it's a really good question, and I guess at this stage you can only hypothesise on what you think might be the reasons behind it. So I think there are 2 in the southwest only. I think there's one in Bristol and there was one down in Plymouth, I think, who've received an outstanding judgment since in the southwest just come out, which is very low. I think what has changed is that inspectors want to see the same level of achievement, the same progress, the same outcomes, the same quality of teaching for all children. So where they don't see it for children with SEN, or if they don't see it for all groups of children, it becomes an issue for that inspector. And I think that is definitely changing things. There are, I guess, 2 reports, and I'm not going to name the schools, but there are 2 RI reports and the new framework in Baines. But if you read them, there is a similarity, particularly around the quality of teaching learning of children with SEN.
I'd just like to also chuck into the pot of considerations funding, shortage of staff turnover, loss of support for specialised for those children who are vulnerable. There's a lot of things going on in schools, and a lot of things have gone wrong.
Carry on, Chris.
I think I've come to the end of the particular slides, but enjoy it at your leisure in terms of go in there and have a read. And there is a lot. There's a lot more. There's a lot else in there in that SEB. So,
Ruth,
can I just ask a question? I don't know if it's fair to ask you to answer it or not, but I noticed about in the Ofsted, it's the state-funded schools that are inspected by Ofsted. And looking up on the government website, it says Ofsted inspections, they also are carried out on non-association independent schools. So can you explain what the difference is between a non-association independent school and another independent school? And there is, they do have an equivalent, don't they, of Ofsted?
Yeah, HMI inspect independent schools.
Sorry?
HMI, Majesty's Inspectorate.
So they do it there, and is it very similar? I mean, do you know anything about their...
I don't know enormous amounts about it, I'm afraid, but there is an inspection framework for them. Yeah.
Sorry to come back on that, because I think it's quite interesting. You know, you're saying at the very first part table, the percentage of independent schools we have here in Bath and North East Somerset is higher than the average in England.
Yeah, twice.
So it would be quite interesting to have but again, it's probably impossible to request it, but to compare the data of all of those results at key stage, was it 1, 2, 4 and 5, for within those two sectors, the independent and the state funded. It would be interesting to compare, wouldn't it?
I think it's published.
Is it? Do you know where you could
no,
can find that? If you do, that would be interesting to know. Thank you.
So are you saying then that the HMI follow the same guidance as the Ofsted inspection in independent schools?
I don't know. I just know it's not. I know it's not Ofsted. It's HMI who do.
Yeah, but
I don't know the phrase.
In order to compare independent schools with state schools, you'd have to go through the same process.
Yeah.
I actually would be very surprised if the HMIs followed the same things Ofsted, personally, because I did work in the area for many years.
Okay, and Liz.
We're going to move us away from Ofsted. I just think they've set the bar very high, and I think they haven't taken COVID into consideration, which is why so many of our schools which were outstanding aren't. But anyhow, I do have a question. Another question to ask you, and it's a challenge. And I wonder, is it to do with the school standards partnership? Because you do say, as most, you are going to. You said we do have an area where we can continue to work strategically with schools and partners to improve education and outcomes for groups of people in BAMES who do not perform as well and struggle are disproportionately suspended from school more than their peers. So you're saying we'd still have a role. So how can we do this when most of our schools are academies?
So the partnership we have with our local area to look at, if you like, commonalities across all schools, if you like, where we see patterns, particularly around exclusions, or where we see patterns around SEN, or indeed around attainment gaps, is our school standards board, and that's where we have conversations with the CEOs. That's where we talk about some of those concerns. They're joined by the regional director's office. So the regional director's office oversees academies in Bath and North East Somerset, and they're there to have that conversation. What I will say is it's not a formal body, so it's not something which is statuted that you must have, unlike Schools Forum, which is a body which has to be there and it's governed by statute. Standards board is a new thing, so if you like, there's no statute authority to drive it to be in existence to do things. So it operates on moral responsibility, if you like. I would have expected to see something in the white paper around actually how do you convene those partnerships in a local area between the local authority and the academies. So that presentation will go through next week with Standards Board, and we'll look at some of that information. We'll have discussions about what can we do, and at different times I've come to this panel and talked about the joint work that we're doing with the St John's Foundations in the early years, the primary, and the work that we're doing with trust-nominated leads across schools, particularly to look at that free school meals gap. So we as an LA, I don't think me or whoever replaces me in the future will ever stop wanting to be interested in that information. I think that we should be interested, which is why we sit here, because there are BAMES children. They're not necessarily our schools anymore, but they are BAMES children, so we want to be interested and ask the questions about the performance of all those groups.
Kevin.
Slightly daydream there. It was an interesting, when you first start off your slides, the context for Bath and North East Somerset, and whether the headlines that sometimes gets presented in the terms of the attainment gap for Bath and North East Somerset is more in terms, or maybe should be more in terms of national comparisons between the free school meal children that are eligible, as opposed to the unique situation with independent schools and various other situations in BAMES that means that probably there is going to be quite a significant gap between us and other local authorities who aren't in the same context.
The independent school data isn't in that presentation, so we are just looking at state schools.
Okay, thank you for that clarification. That's great. Yeah. It's helpful. Thank you.
All done? There's some formidable questions there.
It's not my presentation either, so I had to really learn it.
You fended them off, Mary.
Chair, could I also just say, what Chris hasn't said is that he's also escalated his concerns around exclusions with the regional schools director. So again, as part of the work regionally, that is an area that is under consideration. So it's not that we rest on those attendance or exclusions, not acceptable at all, but that is being addressed, and that's part of the role of the regional director. So just to give some assurance that it has been escalated to that level as well.
Right, so I think we'll bring it to a close there. Thank you very much, Chris. And we note that in the report we've been asked to note it so that that's acceptable to the panel. It looks to be, I can't see any contention there. But it's a formidable challenge that you have there to accept that.
We're busy.
So, moving on to the last item on the agenda, the work plan. And if there are any suggestions for any further items that we transfer over to the scrutiny panel in the new authority, yes.
I'm just picking up on, again, the online safety stuff that kept coming out today. I don't know how we would pick that up, but I would leave that for you two to take forwards in some kind of a way, and also excess deaths, which we know is a massive issue. And again, no one quite knows, so whether we could look at that and get some more data on that, please.
No, yes, certainly. Anything else, Kevin? That's scheduled. Yeah, that's scheduled to come back in September, and it's good that we've got a specific date so that we don't get denied that access, or the next scrutiny panel doesn't get denied that. Liz?
Is looking at dental provision still something that we can have a look at? Or?
Certainly, it's become a national issue now, and
yes.
It's certainly prevalent that the access to NHS dentistry in Baines and nationally is a problem. So certainly we need to consider that. Michelle?
I know that the Climate Emergency and Sustainability panel look at housing, but I was wondering if we could do something about sort of health outcomes for our homeless population in Bath and North East Somerset.
We're giving quite an inventory going forward, but it might not be our responsibility. We'll have to see. Anything else before we close? No, it doesn't. So thank you all. Oh, Leslie's.
Can I just like to thank you both? Michelle, you're fantastic at moving them on and keeping your time, but thank you for being so patient. I do ask a lot of questions, and I think most of us would feel that you're very patient with us. You don't kind of say, well, we've had enough now. You can have just 3 questions and that's it. So, you've made it a panel where we can express ourselves, we can ask our questions, and, on behalf of everybody, I think, I'd like to thank you for your forbearance.
Thanks, very good.
Even if we end at 3 o'clock in the afternoon.
Jerry.
Thank you, Chair. Some of you probably know that I'm not standing for re-election this May.
I understand.
And I was the first chair of our first Health and Social Services scrutiny panel back in 2003. And I think the work that this panel does is hugely important, and I think the issues that it covers are the biggest responsibilities that any council has. And good luck to you all in the future, and I've enjoyed my time this time round on this panel, and thank you to both of you as chair and vice chair, and good luck in the future. I might come back as an employee depending on what happens in 2024.
Michelle?
As we're doing some kind of like Oscar ceremony, I'd just like to say thank you to Mark for keeping us all in check. Thank you for all your hard work.
Mark actually does a lot in controlling me.
That's what I meant to say.
But no, thank you all. I mean, it's a very serious panel, this, and it's difficult to close you down because you have such appropriate questions, and restricting it to 3 questions per person, I think that's been too bureaucratic. We need to get to the roots of some of these very emotive subjects that we have to deal with. So thank you all very much. I don't know if we'll meet again because I don't know even what will happen to me. So there you go. But thank you all very much. And certainly thank you to the officers. We've got a splendid team of officers that support us. So that needs to be recognised. So thank you all round. Thank you. I declare the meeting closed.